Now, the reason why brain-based therapy is so successful is because we look at the whole child, we analyze the abnormal neurology, so we do a brain functional exam and we determine which parts of the brain are functioning well, which parts are not. We look at the neurotransmitters. We look at them from a metabolic perspective, which means we look at their nutrition, we look at their food sensitivity, their blood sugars, we look at their physiology, and we also look at their home environment. So what are the typical traditional treatments? Well, you've got medication. Everybody's heard of medication. That's what most people think are their only choice. You've got Ritalin, you've got Strattera, you've got Concerta, you've got Adderall. All of these are various stimulant medications that increase the activity level of the brain as a whole. Now, as you know, they have side effects. Side effects that we're going to list here in just a little bit. The other problem is that if your child skips a dose, the behaviors come right back. So they only work when your child's taking the medication. So they're not really fixing the true underlying cause. They're really just sort of masking the symptoms by increasing the activity level of the brain. When they're off the medication, again, the behaviors come right back. Now, the other problem is they can't take the stuff forever. They really can't be on the medications forever. And number two are the side effects. Here's a list of some of the side effects of these common medications. Number one is anorexia, insomnia, weight loss, and that's because of the stimulant activity of the drugs, emotional liability, depression, abdominal pain, seizures, dizziness, increased heart rate. Again, that's the increased stimulation, the sympathetic aspect, mood swings, dry mouth, vision issues. So these are all some of the side effects of the common medications, the stimulant medications. Now, of course, then there's occupational therapy, there's behavioral therapy, there's educational therapy, different kinds of sensory integration, listening techniques, and I think all of them are useful. I think they work. They're all very good. They're not bad for your child. They're excellent for your child. However, the problem is this: none of them take into account the issue of the hemispheric imbalance between the left and the right brain. They do nothing for the functional disconnection. So, for example, is the left brain moving better? Is the right brain decreased? They don't look at that. The other thing they don't look at is what parts of the brain are not functioning well. Is it the frontal lobes? Is it the temporal lobes? Is it the parietal lobes, the occipital lobes? And then which part of the brain? I mean, in the frontal lobe, you've got the dorsolateral prefrontal cortex, which is essential for concentration and focus. Is it the medial orbital, which is very important in not being impulsive? It has connections to what's called the limbic system. So that's a big thing. The other thing is they don't look at the metabolic capacity of the child, meaning what is their stamina? How much can they take of a certain therapy before that therapy becomes counterproductive? How much do they need for it to be productive? There's a fine line there to getting good, healthy brain changes. So I'll give you an example. If you look at the chart there, basically, let's say we do a typical treatment, a drug or something like that, and we have this child who has a brain output, if you look on the left, where the right brain is sitting at a lower aspect and the left brain is higher, which is typical of most ADHD kids, and they have a typical treatment. They take a medication or something of that nature. And now, if you look on the right, after the treatment, what does their brain output look like? Well, the left improves and so does the right. They both go up. The question is, are they any better? Yeah, absolutely they're better because their brain is firing faster. But the trouble is both sides of the brain increase. The problem is there's still a discrepancy between the right and left sides of the brain. There's still what's called a functional disconnection syndrome. And that needs to be addressed, because if it's not addressed, these problems are going to stay there. They're going to persist into adulthood and cause a whole host of problems. So basically, medication, the stimulant medications, they do nothing to address this discrepancy between the right and left sides of the brain, so the functional disconnection stays there. And the trouble is these problems tend to continue in into adulthood. And again, they can cause a whole host of problems. So what I'd like to do now is go over some startling statistics that I think every parent should know All parents should know that, especially parents that have ADHD children. So number one, 50% of children with ADHD will have some of their symptoms persist into adult life. And adult ADHD can lead to risky behavior, inappropriate sexual relationships, and antisocial behavior. Number two, 20% of ADHD adolescents show serious signs of depression when they get to their teen years. And number three, ADD and ADHD teens are 2 times as likely to smoke, 12 times more likely to use drugs and alcohol. Number four, ADD and ADHD adolescents are 4 times more likely to be involved in a fatal car accident, as compared to adolescents without ADD and ADHD, for obvious reasons. If they're not focusing while they drive, it's going to increase their percentage chance of having a car accident. Number five is after 1 year, 80% of ADHD children are no longer taking their medications. And that's typically because most of them find them not effective, or not effective for the long haul. And the last one I'd like to go over is the yearly cost to maintain an ADHD child is $15,000 per year out of pocket. So there's some pretty startling statistics, and reason enough to try to get this thing under control to really improve your child's future.